What environmental factors increase reproductive cancer risk? Many factors in our environment can influence the risk of developing reproductive cancers, including those affecting the testicles, cervix, ovaries, and uterus. These factors often involve exposure to pollutants, chemicals, radiation, infections, and lifestyle influences that can impact hormonal balance and cellular health. Understanding these risks helps us make informed choices about prevention and awareness. Air pollution is a significant environmental concern linked to reproductive cancers. Fine particles in the air, such as those from vehicle emissions or industrial processes, can enter the bloodstream and reach reproductive organs. Studies have shown that higher levels of pollutants like particulate matter, ozone, and sulfur dioxide are associated with increased risks of ovarian and uterine cancers. These pollutants can cause cellular damage, which may lead to cancer over time. Chemical exposure is another important factor. Many pesticides, industrial chemicals, and substances known as endocrine disruptors can interfere with hormone systems. Chemicals like bisphenol A, found in plastics, and certain flame retardants can mimic or block hormones, potentially leading to abnormal cell growth in reproductive tissues. Long-term exposure to these substances has been linked to ovarian and breast cancers, and ongoing research suggests possible connections to other reproductive cancers. Ionizing radiation, such as that from medical imaging or environmental sources, is a well-established risk factor for certain cancers. It can cause DNA damage in cells, which may result in mutations that lead to cancer. While necessary for medical diagnosis, minimizing unnecessary exposure is important for reducing risk. Asbestos exposure, often associated with occupational hazards, can also affect reproductive health. When inhaled or when fibers come into contact with the genital area, asbestos can migrate to the ovaries and cause chronic inflammation. This inflammation is believed to increase the risk of ovarian cancer, making occupational safety measures essential. Some studies suggest that talc-based powders used in the genital area might increase ovarian cancer risk. Talc particles can reach the ovaries and cause inflammation, although research is still ongoing to confirm this link. It's advisable to be cautious with talc products and consider alternatives. Socioeconomic factors and the built environment also play a role. Communities with higher pollution levels or limited access to health care may experience higher rates of certain reproductive cancers. For example, areas with poor air quality and limited screening services can lead to later diagnoses and worse outcomes. Infections are a major environmental factor for cervical cancer. Human papillomavirus infection is responsible for most cases. Factors that increase infection risk, such as lack of vaccination or screening, can raise the chance of developing cervical cancer. Promoting HPV vaccination and regular screening are key preventive steps. Lifestyle choices influenced by the environment also matter. Obesity, physical inactivity, smoking, and alcohol consumption are linked to increased risks of breast and other reproductive cancers. These behaviors can be influenced by access to healthy foods, safe spaces for exercise, and community support. While research on testicular cancer suggests that exposure to endocrine disruptors and certain occupational chemicals during critical developmental periods may play a role, the environmental risk factors are less clearly defined compared to other reproductive cancers. To reduce personal risk, it's helpful to limit exposure to known carcinogens like air pollution and asbestos, avoid unnecessary use of talc powders, and stay up to date with HPV vaccinations. Maintaining a healthy lifestyle with balanced nutrition, regular physical activity, and avoiding tobacco and excessive alcohol can also make a difference. Public health policies aimed at improving environmental quality and ensuring equitable healthcare access are vital for broader prevention. Always remember, individual risk varies, and it's best to discuss personal concerns with healthcare professionals. They can recommend appropriate screening and preventive measures based on your unique health profile. Staying informed and proactive is the best way to support reproductive health and reduce cancer risk.